with that beautiful welcome to country. My name's Rowena Clift and I'd like to welcome you to the Western Victoria Primary Health Network Primary Care Refresher 2021. I'd like to acknowledge that I'm on Gunditjmara country myself. I really would like to welcome our board chair, Lynne McLennan, to say a few words.
Thanks very much, Rowena. So I'd like to welcome everyone to this special yearly event, the 2021 Primary Care Refresher. It's been my privilege to be the chair of the West Vic Primary Health Network Board since 2015. And on behalf of the Western Vic Primary Health Network, I'd like to also acknowledge the traditional owners and custodians of the lands and the waterways and acknowledge the land on which I am meeting this morning, which is the Arakan land in northern New South Wales, and acknowledge the traditional owners of this land. We certainly recognise that the diversity, resilience and the ongoing place that our Aboriginal and Torres Strait Islanders people hold in our communities is essential to the well-being of our region. We pay respects to elders, both past and present. We commit to working together with them in the spirit of mutual understanding, respect and reconciliation. We'll continue to work with Aboriginal and Torres Strait Islander people in partnership on the Closing the Gap program. I'd like to issue a very warm welcome to our keynote speaker for today, Professor Michael Kidd, AM, who is the Deputy Chief Medical Officer for the Department of Health. And our CEO, Rowena, will welcome Professor Kidd shortly. Also, a welcome to all of our presenters across the 2 days who've generously given their time and expertise, and to all our delegates who are attending today. In my case, I've been working in primary care for a very long time, and like many of you, have been working in an organisation that's been at the front line over the last, now sadly, 15 months dealing with COVID-19 outlook. And I think things are quite different in our world than they were the last time this refresher was run 2 years ago. And how wonderful it is that our organising team had decided this would be a virtual event, because if we'd tried to do it in person, it wouldn't have happened. So it's wonderful we've had professional assistance in setting up this event today. Previously, when we've had face-to-face refreshers, we've had about 150, but today's and tomorrow's event, we have more than 250 participants registered, which is an excellent result. So this format means that everyone can access the conference easily, depending on your internet connection, without any travel constraints. We're also very pleased this year that the refresher's expanded and now includes all health professionals alongside GPs, with the 2 streams as follows. The GP stream is covering important topics relating to GPs only, and the primary care stream covers important topics relating to GPs, practice managers, practice nurses, practice staff and allied health professionals. So I'd like to thank everyone who's joining us today for your efforts over the last 15 months with the challenges of COVID-19, with the COVID-19 vaccine rollout and the issues arising from deferred care. COVID-19 continues to be the biggest healthcare challenge of our generation, and what it means for the future of primary health is yet to be fully understood. There have been a lot of challenges in the primary care sector, and we've worked at the PHN to continue to support health practitioners with updated information and other forms of support. So we have been listening to the practitioners in our region and adjusting our approaches as we hear from you about what works and also what's needed to change. So please keep telling us what is helpful and what isn't, so that we can give you the best support that is possible. I hope you enjoy this 2021 Primary Care Refresher weekend, and I think you should take a moment to congratulate yourselves on investing in your continued professional development and the ongoing good care of your patients. Hopefully next year we can see each other in person. Thank you very much for listening, and I'll now pass you back to our CEO, Rowena Clift. Thank you.
Thanks, Lynne. For those who don't know me, my name's Rowena Clift. I'm the Chief Executive Officer of Western Victoria Primary Health Network, and I've been in the chair for 9 months, and that's a total 9 months of pretty much COVID and not really much face-to-face. So it's really great to be with you today. Western Victoria Primary Health Network acknowledges the traditional owners and custodians of the lands and waterways, the Wadawurrung, the Gulidjan, Garabunud, Kiwe-Wurrung, Gunditjmara, Jabba-Wurrung, Watchabulik, Jadawali, Wagaya, Jadwa, and the Jakabul peoples. We recognise their diversity, resilience, and the ongoing place that Aboriginal and Torres Strait Islander people hold in our communities. We pay our respects to the elders, both past, present, and commit to working together in a spirit of mutual understanding. We support self-determination for Aboriginal and Torres Strait Islander people and organisations, and we will work with them in partnership in closing the gap. I would like to extend a big welcome to our keynote presenter, Professor Michael Kidd, our conference facilitators, our session presenters, our panel members, who will all be speaking over the next few days. For more information on our presenters, please refer to the conference booklet. I'd also like to acknowledge the tireless work of the team, the Primary Care Refresher Planning Committee, and thank the conference facilitators for making this event possible. Many of you spoke to me about why not face-to-face, and in some ways I did breathe a sigh of relief that maybe we made that right decision 6 months ago, because we've been able to continue today. I would also like to acknowledge the important contributions of our conference delegates, Western Victoria Primary Health staff, and the conference sponsors for supporting this annual event and to ensure quality educational program and is successfully delivered. I acknowledge our sponsors, AbbVie, AstraZeneca, Benson's, Bristol Myers Squibb, Pfizer, GMHBA, Hospice, Lake Imaging, and Lundbeck. Western Victoria Primary Health Network has an important role in helping to deliver best practice primary health care across our region, which compromises 21 local governments and a total population of approximately 618,000 people. The vital work, part of what we do, is to support general practice and all healthcare professionals with the resources and opportunities to expand their knowledge base and overall professional development. This year, our Primary Care Refresher is a key event that helps us achieve this objective, and this year's theme is Partners in Prevention. Preventative health is a key part of Australia's long-term national health plan alongside mental health. The Australian government has developed a draft 10-year national preventative health strategy, and this strategy aims to see Australians live an additional 2 years of life in good health by 2030. This includes people in low socioeconomic groups and regional and remote areas. The strategy will guide the long-term approach to prevention in Australia. It aims to ensure that Australians have the best start in life, Australians live as long as possible in good health, that we target populations to have health equity, and to increase the investment in preventative health by 5%. The strategy outlines that almost half of all Australians have health conditions that can be prevented with a healthier and more active lifestyle. So what does the future of primary health care look like, and how do we support you as our primary health care professionals? We know we're looking at more comprehensive and targeted data. We want to tell the story behind healthcare data, create new knowledge which can be used to improve our programs, and to support general practice more generally. We do this through a number of means. We have our regional needs assessment. We use our data to ensure that the allocation of funding is evidence-based. The volume and the nature of service delivery across our region is aligned to where we see gaps in service delivery and where there is the highest health need, not just by population numbers. We also do this through quality improvement, through PEN Exchange, the PHN Exchange, the CAT4 tools, and general practices have access to a secure dashboard of key indicators for their patient population. This can be used to plan, measure quality improvement activities, and be evidence for the PIPQI. We also do this through childhood immunisation. And in Western Victoria, we're very proud to boast some of the highest childhood immunisation coverage rates in Australia. And that's due to you, to the dedication of our immunisers and our wider primary health care community. Our rates sit above the benchmark of 95% for all age cohorts in both reports, all children and Aboriginal Torres Strait Islander children. And we're working very hard to support our local immunisers to actively work with patients and embed systems to ensure that all children are followed up for timely immunisations as per the National Immunisation Program. An exciting new development is our remote patient monitoring. Care Monitor is a remote patient monitoring tool. It assists general practices in supporting their patient population who are self-managing their chronic condition. This is being done by a patient app aligned to the patient's condition and works with support from the general practice. This program is especially important in supporting those in our region that live rural and remote and have reduced access to services. So we continue to put resources into preventative health programs, and we encourage all of you to engage with us on how we can make our community stronger and healthier. I want to thank you all for making the time this weekend. Hopefully, like me, there's no footy and netball, so you'll be able to relax and really immerse in this program this weekend. This refresher encourages primary care professionals to learn with peers and to ensure that we're all informed on contemporary and best practice primary health care. It is now my very great pleasure to welcome our keynote speaker, Professor Michael Kidd AM, who is joining us at this incredibly busy time, and he has taken the time, he's taken on the role of Acting Chief Medical Officer just this weekend. So Michael, thank you so much for making that possible. Professor Kidd is the Deputy Chief Medical Officer, Principal Medical Advisor with the Australian Government Department of Health, where he is leading Australia's national primary care response to the COVID-19 pandemic. He is also the Foundation Professor of Primary Care Reform at the Australian National University. Professor Kidd is a general practitioner, a past president of the Royal Australian College of General Practitioners, a past president of the World Organisation of Family Doctors, and a past dean of the Faculty of Medicine, Nursing and Health Sciences at Flinders University. I warmly welcome you, Professor Kidd, to our wonderful Western Victoria region and with our wonderful teams of primary health professionals. And I really hope you have a wonderful time today. And I really want to thank all of you for joining us today, and have a wonderful 2021 primary care refresher.
Thank you, Lynne, and huge thanks to Karina for that wonderful welcome to country that began today's event. I'm speaking to you today from Ngunnawal country, which is where Canberra is located in the Australian Capital Territory. I want to say big thanks for inviting me to join you for this event. I have a long past history of association with Western Victoria. I did part of my medical training at Ballarat. I worked for some time as a general practitioner in the rural town of Dimboola. And when I was the Dean at Flinders, I was also the chair of the Greater Green Triangle University Department of Rural Health Board, which of course was based in Warrnambool and Hamilton. So it's really great to be joining with you all today. I hope that you can see my screen, and if someone could just tell me that you can see that, that would be helpful. Thank you. So I thought I'd start with this this image of one of my favourite places in Western Victoria. This is the Little Desert National Park, the beautiful Wimmera River with lots of water in it. I wanted to also start by saying a huge thank you. Thank you to everybody who is on this meeting or this conference today. Thank you for all the work that you've been doing throughout the COVID-19 pandemic to support your patients, to support your community, to support the people of your region of Australia. It's very much appreciated, and my thoughts are with everybody in Victoria over this 7-day period when you find yourself back in lockdown with further community transmission of COVID-19 occurring. I'm going to talk a little bit about what we've been doing in primary care throughout the pandemic and what we may be doing beyond the pandemic, but I also wanted to talk a little bit about some of the national reforms which are underway as well. Clearly, we're all involved in stopping the spread of COVID-19. We're all involved in staying healthy and helping our communities to stay healthy. But I wanted to say a huge thanks to the PHN for the work that you've been doing throughout the pandemic. Our PHNs have been involved in many, many ways in supporting general practitioners, primary care nurses, allied health professionals across the region in protecting the community. And that's included identifying and supporting the sites which became general practice-led respiratory clinics, and you have 5 of those in your region, in Geelong and Ballarat and Horsham and Warrnambool and Ocean Grove. You've been involved in rolling out personal protective equipment to primary care professionals and clinics right across the region in order to protect our workforce. You've been involved in support for the vaccination program, including supporting the vaccination of people living in residential aged care and disability care, and in many other ways. And for me, it's shown how important our network of primary health networks is to the health and well-being of the people of Australia and to supporting the incredibly important primary care infrastructure that supports the health and well-being of everybody. A little bit of an overview of primary healthcare in Australia. The figures from 2018-19 show that our total health expenditure was nearly $200 billion. That year in Australia, it was 10% of our nation's overall economic activity, and primary healthcare accounted for around 1/3 of our total healthcare expenditure in Australia. Hospitals accounted for 40%. Other components of the health system, including consultant specialists working in the community and many other services, accounted for the remaining percentage. A huge number of Australians are involved in delivering healthcare to the people of our country. And a core component of healthcare in Australia is our network of 31 primary health networks, commissioning services in areas of national priority, in mental health, in Aboriginal and Torres Strait Islander health, in population health, digital health, aged care, alcohol and other drugs, health workforce programs, and many more to support the people of their local communities. Rowena mentioned Australia's long-term national health plan. This was released in August 2019, and doesn't August 2019 seem like a very long time ago? But the national long-term health plan outlines the vision for Australia to continue to modernise our healthcare system with the aim of Australia having the very best healthcare system in the world. And it aims to build a health system which is even more integrated, even more efficient, even more focused on patients and more equitable in the delivery of healthcare, access to healthcare and outcomes of healthcare. The plan charts the way forward over the next 3 years and also over the next 10 years with a very strong focus on preventive care, on primary care, on mental health, on improving our hospitals and on medical research. One component is the primary healthcare 10-year plan, which is currently under development and which will be rolling out between now and 2030. And the objects for reform in primary healthcare include improving access for all the population to primary healthcare services, including for people in rural and remote communities, for people with diverse backgrounds and lived experience, for people with disability, for older people and for hard to reach and at-risk groups. And obviously it's a very important component of the work which the PHN is doing. It includes a focus on close the gap and continuing to improve health outcomes for Aboriginal and Torres Strait Islander people. It includes a focus on keeping people well in the community and away from hospitals through helping people to manage their own health and well-being, through strengthening preventive health care and health promotion, to putting people in control over their own health. It includes a focus on continuity of care, absolutely fundamental in the work that we do in general practice, supporting continuity of care across the healthcare system, in integrating care, getting better integration between the different elements of our healthcare system, in focusing on future needs and the use of technology in the future and future expansion of digital health and its impact in helping to support improvements in the care that we provide, and a very strong focus on safety and quality right across our healthcare system as well. The 10-year primary healthcare plan is in partnership with the other plans which have been developed and released or which are being currently developed by the Australian Government Department of Health, which includes our National Preventive Health Strategy, which people will be talking about through the conference. It includes our National Obesity Strategy and our National Injury Prevention Strategy, which are due for release this year, our National Women's Health Strategy, Men's Health Strategy, and the Action Plan for Children and Young People, which have all been released already. So that's the context that we're working in. But I wanted to particularly focus on what we've been doing during COVID-19 and the great work which you have been doing to support your local community. And I want to do this based on the 5 principles of Australia's primary care response to COVID-19. Australia is one of the few countries in the world which actually developed a specific primary care response to the pandemic. And I want to just explain the elements of that to you and where we all fit in. The first is that we are the people who are involved in protecting the most vulnerable people in our community. And that goes also for the people who are most vulnerable to infection with COVID-19 and developing serious disease and being at risk of death. People who are elderly, people living in residential aged care facilities, people who have chronic health conditions which put them at increased risk if they were to contract COVID-19, Aboriginal and Torres Strait Islander people. Many people in our community who, of course, are all part of the patient populations that we look after in general practice and in other parts of our primary healthcare system. And it was recognised very early in the COVID-19 pandemic that we needed to do all we could to protect these people. And that's why right at the start of the pandemic, the Australian government introduced telehealth initially to allow health professionals to provide medical care, support and advice to people who are vulnerable in their own homes, meaning they didn't have to leave their homes and be exposed to the risk of COVID-19. That over a few days, that then expanded to recognise that some healthcare professionals ourselves are vulnerable people also. And so vulnerable healthcare professionals were able to
Oh, hello everyone. We've had a bit of a technical issue, so just bear with us. While we're waiting, I will just introduce myself. Good morning, everyone. I'm Anne Stevenson, and I am a GP and talkie, and I will be our conference facilitator. And hopefully we're going to get Michael back any moment. But I'll just let you know that there is some buttons on the bottom that you can see and one of them says live Q&A. So that is a very useful, if you want to ask any of our presenters a question, that's where you put your question. We are running a little bit behind time, so I'm not sure whether we'll be able to do that with Michael today, but if you do have a question, I encourage you to write it in the live Q&A. So, well, I can't actually think of a better way to spend a rainy, cold weekend in lockdown than the PHN conference in the comfort of your own home. I think we've got Michael back, so I will be back. Thank you, Michael. Do you want to take over again? I think you froze. I think.
Okay, can you hear me okay? Great, okay. How's that? Okay, so I'm not sure where I got up to because I was happily talking to myself and not to everybody else. But anyway, we'll keep moving through. So I was talking about telehealth and the introduction of telehealth over a 10-day period and how important this has been to allowing us to protect vulnerable people. And of course, now in Victoria, you're using telehealth again during this period of lockdown to look after your patients. The second important principle in Australia's national primary care response was recognising that there was a risk in having people with possible COVID-19 being mixed in waiting rooms and in clinical settings with people with other healthcare concerns. And so that's why the Australian government very quickly worked with PHNs, including your own, to establish the general practice-led respiratory clinics right across the country. And we now have 150 of these clinics. Of course, many of them now are also getting involved in the delivery of the COVID-19 vaccines to their local population. These respiratory clinics have been really important because they've allowed us to not only test people for COVID-19, but to assess people with possible respiratory symptoms, because not all respiratory symptoms are due to COVID-19. And so people have been able to continue to be assessed. People have been able to be tested in a way which also allows other aspects of our healthcare system to continue to function. Thirdly, we recognised very early on that we needed to ensure the continuity of regular healthcare services for the whole population. The experience from past pandemics and epidemics around the world has shown that often people neglect neglect to get care for other healthcare concerns during a pandemic, and that this can lead to a long tail of preventable healthcare problems and the risk of death. Indeed, in some past epidemics, more people have died from other preventable healthcare concerns than have died from the infectious agent. So we were very concerned to ensure that we could continue the management of acute conditions, the management of people with chronic healthcare concerns, the management of people with mental health concerns, and continue preventive care interventions, immunisation programs, cancer screening, and other preventive programs, so that we don't see this subsequent tail of people with preventable healthcare problems which arose as a result of not seeking care during the pandemic. And again, thank you to everybody for the work that you've been doing, ensuring that continuity of care. The fourth important principle was recognising that it wasn't just people working in hospitals who are at risk of being exposed to COVID-19, it was everyone working in healthcare coming in contact with members of the public, and the importance of providing protection and support of our primary healthcare workforce and our primary care services. Now, this was very challenging. You'll recall at the start of the pandemic when we experienced a global shortage of personal protective equipment, the rationing of equipment, and the Australian government rapidly released personal protective equipment from the national medical stockpile out to primary health networks for distribution out to primary care settings, to general practices, pharmacies, community nurses, allied health professionals, and other primary care settings, as well as to residential aged care facilities and disability care facilities in order to protect our workforce. And the fifth principle was recognising that Pandemics lead to very significant trauma and loss among members of the community, including people working in healthcare, and the need to provide mental health services both now, including through telehealth, but also into the future. The pandemic has disrupted all of our lives, and of course, people in Victoria living through this once again with the lockdown, with people not being able to leave their home, apart from the 5 specified reasons, children's education being disrupted once again, loved ones not being able to come together, the disruption of weddings and funerals and other very important events in our lives. And so further support has been provided to allow more mental health services to be provided to the community. And of course, now we have the vaccination programs rolling out. Yesterday was a record day in Victoria for vaccination against COVID-19. It's remarkable to think that the very first COVID-19 vaccine was administered on just February the 21st in Australia, just over 3 months ago, when 84-year-old Jane Malisiak received the very first Pfizer shot in Australia. And then on March the 2nd, South Australian general practitioner Carol Fegan received the first dose of the AstraZeneca vaccine in Murray Bridge, just over the border from your PHN in South Australia. Indeed, we're only just next week coming up to the end of the first 12 weeks of the AstraZeneca vaccine rollout, and people will start to receive their second doses of that AstraZeneca vaccine. But I want to say a huge thank you to everybody who's been involved in the COVID-19 vaccine rollout. This is an incredibly important component of protecting our population, particularly protecting the people most at risk of COVID-19. I'm very pleased that all the residential aged care facilities in your part of Victoria, I'm advised the residents have all had their first doses of the COVID-19 vaccine. So thank you to everybody who's involved in rolling out the vaccines. I know that some of you haven't received as many vaccines as you'd like for your patient population. Recently, the number of doses available to individual general practices have been increased, and working together will vaccinate our entire population. I just want to finish by just talking about what things are going to look like, though, in a post-pandemic world, if indeed we do reach a point of being post-pandemic, or the situation where COVID-19 becomes another endemic disease which we learn to live with. Clearly, vaccination is incredibly important, but of course we're learning more and more about COVID-19 every day. The new variants which have appeared around the world, learning about whether those variants are more infectious, whether they are more likely to affect other members of the population, including children and younger people, whether the vaccines which we currently have available are going to be fully effective against the variants, whether we're going to need boosters each year as we currently have for influenza, and what will the role be of those of us working in general practice and other primary care settings in supporting our patients. I think there's some important challenges here at the moment for the PHN, and I know that you're working on these areas and thinking about these areas, but among the important challenges right at the moment is, what do we do together to ensure that every homebound person in Western Victoria is given the opportunity to be vaccinated against COVID-19, the frail elderly, people with disability, people with mental health concerns who are unable to leave their homes to come to our clinics to get vaccinated. What do we do to ensure that every resident in residential aged care and disability care settings across Western Victoria is immunised? Of course, we've rolled out the initial immunisation, but we have new people entering residential aged care and disability care every day across the region, and what do we do to support business as usual with making sure that those people have been protected against COVID-19 if they haven't received vaccination, either when they've been living in the community or if they've been in hospitals or other settings awaiting a move to residential aged care. How do we ensure that nobody in the community misses out on being immunised just because they are poor or new immigrants arrive to the region or don't have English as their first language or are Aboriginal or Torres Strait Islander or homeless or have chronic mental health concerns or live with a disability? The people who often miss out on access to some of our healthcare services in Australia. We can't afford for these people to miss out on immunisation and on the other measures which will protect our population during the pandemic and as we learn to live with COVID-19. So I might stop there and I'm happy to take any questions if there are any.
Thank you so much, Michael, for that comprehensive review, really, of what's happened to us over the last 12 months and what to expect in the future. It's really interesting, isn't it, to look back so much has happened in 12 months. We've learned a lot. And I was just reflecting on what a resource you are with your background in general practice, but also now just all your understanding of government and public health. Thank you for all the work that you do. We really, really appreciate your work too, and being an advocate for general practice, because you are definitely seen as that, and we thank you. I just want to encourage everyone, if you have got a question for Michael, if you write it in the Q&A box. Nick has got a question here. Dr. Nick Brayshaw, who's well known to our community. I'll read this question out. Thank you, Michael. A coordinated NPH, I think that's the National Prevention Strategy, is much needed to address determinants of poor health population-wide, but implementation will no doubt depend on cross-government commitment and broad community commitment, I guess. Buy-in. What do you see as the drivers to translate this document into an enduring reality? What roles can the PHN and GPs have in this?
Absolutely. So thanks, Nick, and good to hear from you. The National Preventive Care Strategy is going to be absolutely essential to ensuring the ongoing health and wellbeing of our population. And as GPs, as everyone working in primary care world, of course, we're already part of rolling out preventive care and health promotion to our patients and our communities. We often, of course, hit frustrating barriers in being able to do some of the things that we need to do, and that's why integration of our healthcare services is going to be so important. I think one of the things which has arisen, things have changed dramatically over the last 15 months as a consequence of the pandemic, but one of the things which I've found most remarkable has been how well the Commonwealth and the state and territory parts of the healthcare system have been working together over the last 15 months, how well we've been able to share data between the different levels of government in order to support and continue to improve the programs which are there to support the people of our nation. And I hope that we can take some of these lessons and apply them to other aspects of rolling out healthcare programs. Clearly, the PHN is going to be essential in rolling out elements of the National Preventive Care Strategy, and I know you're going to have some discussions about that over the weekend. But I think that everything is on the table and, open to new ideas about new ways of doing things. The other thing which has really changed in the last 15 months, and, change happens while we're not watching and paying attention, but I'm really conscious about how much digital health has improved in the last 15 months, and particularly our ability to access big data and to better understand.
Oh, I think Michael's frozen again. So that's my cue to come in. We'll wait. Should shortly be. This is likely to happen this weekend. A little bit of this freezing and technology. I have to reflect that it's been so, he's back on. Thanks, Michael.
Thank you. So I'll stop there.
So there was one other question, but it's probably hard to unpick it. It says, I missed the second point. So I'm not sure which point that was that person missed in your talk. I don't know. It might be difficult to unravel that
that's easy. Number one, protecting vulnerable people. Number two was providing the COVID-specific healthcare services away from regular healthcare services. And that's the establishment by the PHN of the GP-led respiratory clinics in your local region.
Yep. So another question here. Thank you, Michael. Given the challenges of the healthcare home program, what learnings will be taken forward for alternate funding models in general practice?
So one of the areas that the Primary Care Reform Steering Group, which is providing advice to the Australian Government on the reforms, has been looking at is the issue of voluntary patient enrolment and the ability to have people, if they choose, enrol or register with an individual general practice, and then for that practice to be responsible for providing whole health care to those individuals who are enrolled with the practice. So this builds on the experience of the healthcare home model, which some of the practices in the region were involved with, that mainly focused on people with chronic health conditions. The voluntary patient enrolment, initially the thought was about opening it up to older people, but thinking now is that perhaps it's something that we should do for everybody. One of the challenges we have in general practice is we know the patients we know and we don't know the patients we don't know. So we know the people who come and see us, but often we don't know the people in our community who don't come and see us. Perhaps in a small rural town, everybody knows everybody, but if you're living in a larger regional centre or in Geelong or Ballarat, the big cities, there are people who are often invisible to our healthcare system. And other primary care systems in other countries around the world tackle this by having registration or enrolment of the entire population with individual general practices, and those general practices then being supported to provide care to everybody. So hopefully these reforms will bring about a more equitable system, but also will support you in the work that you're doing, because I know we're all committed to providing high quality care to everybody in our local communities, and we need to be supported in doing so.
Okay, I think we will have to finish up soon, so we have enough time, but the questions are rolling in. So from Anonymous, primary healthcare nurses play an important role. How are they being included in the primary healthcare reform?
Yep, absolutely. So primary care nurses are represented on the Primary Care Reform Steering Committee, as are allied health professionals, and of course GPs and the PHNs and pharmacists. So everybody is there working together. Our primary care nurses play an incredibly important role in the delivery of primary care right across Australia.
The increased mental health access is welcome, but with the roller coaster this pandemic has produced, it is concerning that extra sessions will be ending. Is an extension to this likely?
Yes, look, I think it's really important that people are providing feedback on programs like that and letting the government know, particularly through your representative organisations, the medical associations, the colleges, and also through your PHN on what you think needs to happen. You're the people delivering these programs on the ground. Please let us know what you think needs to take place.
And this will be our last question from Paul Egan. Thanks, Michael. Respiratory clinics did a great job, but GP clinics were in the front line assessing patients, often in car parks. I think we should have a higher priority than 1B in the immunisation schedule, realising there was a shortage of vaccine.
Yes, look, I don't disagree with you. Obviously 1A and 1B were rolled out very quickly together, but as I mentioned, one of the core principles is recognising that we need to protect the people working in primary care just as we're protecting people in hospitals and in emergency departments. Thanks, Anne.
Thank you so much. I actually, there's a new term. It's called car park medicine that didn't exist till last year. Doctors out in car parks assessing people. Yeah. Oh, look, thank you so much, Michael. And once again, thank you so much for all the work you do. We really appreciate it. And thanks for coming and speaking to us today. And again, it's just, I think this technology that we're using so much more effectively now means that we can have speakers such as yourself. So that's probably the one good thing to come out of COVID, how well we can use our technology. So
next year, I hope I can join you in person.
Yes, thank you. One thing, can we have a contact email for Michael? Oh, you might get bombarded.
No, that's fine. My email is publicly available. It's michael.kidd@health.gov.au.
Great. Thank you so much again.
Thanks, everyone.
Big hand of applause in our little studies or wherever you're locked away. So I will just do my little introduction. I already have said that, yes, I'm Anne Stevenson, and I'm going to be the conference facilitator over both Saturday and Sunday. And this is the first time we've had the two streams, with the primary healthcare stream and the GP stream. So we really welcome that. And I will introduce our facilitators for the primary health stream. So we'll have Claire Dagley today, and she's West Vic PHN Senior Manager at Great South Coast, and tomorrow will be Linda Govan. So she's Senior Manager at Ballarat Goldfields. So that's wonderful. So really, I'm just going to open my screen here. The main thing I really need to communicate to you is a little bit of the housekeeping of the weekend, because once you get your head around all this, it's actually really easy, but there is just a few little things. So each session you will have to go into separately. So when we finish this session, you will leave, and then on your screen will be a new screen, and you will do that for each session you go into. So that's very important. The button will display preview when the session has not started, and once it's started, you just press the button join and off you go. And select back to timeline, which is located in the top left of your screen, to return to the program list and enter your next session. It'll become obvious once you look at your screen. Each session will run for 50 minutes, and there will be always that opportunity for the Q&A at the bottom of your screen. And we really encourage you to write your questions in the Q&A, not in the discussion. This discussion is more for talking amongst yourselves about issues. I'm just going to check. There are links to websites and resources, and they will need to be copied and pasted into your web browser. You won't be able to just click on the link, and the handouts from the session will be available in the handout box to the right of your screen. All attendees will receive a certificate of attendance for the conference and for any individual sessions you end, and they will be emailed in the next couple of weeks. This event is accredited with the RACGP and ACRM, and the PHN are applying for points at this moment, and nurses and allied health providers will be able to self-report coming along. We've already experienced it. Because it's a virtual conference, there may be little issues along the way where the person gets stuck or freezes. So just be aware that often just with time, it will just come good. But it does rely on an internet connection, and you may, if your internet connection is not good, that will affect things. If you have any issues, you can, when the session blocks, there's a little button on the top of your screen which you'll be able to click, and that is a live support. So So there's a lot here. There's lots. When you're in your screen, I just encourage you to press all the buttons, because that will sort of open up what's what. There'll be a resources gallery on the right side of your screen, and that have downloadable PDF resources from West Vic PHN. So just make the most of just going through everything. We also have a competition, and this competition is every time you go to a session, this will be tallied up, and if you go, the more sessions you go, the more chances you are to win the competition. And the competition is a $200 voucher to spend at JR Medical Books. There'll be also a competition for those who fill out your evaluation. There will be okay, we're running out of time. I think they're the main things. So I hope you enjoy the conference, and make sure you leave and click on the next session. Thanks very much.